All right, so my name is Veronica Arbuckle. I am a now PGY1 after residency, practicing family medicine in California currently. I'm from California originally. I went to MSU CHM for post-bac year and then did my medical school training there in Lansing. I stuck around and did my residency also in Lansing at Sparrow there. Not being from California, not being from Michigan, I was, a little worried that doing the TIP program wasn't going to be successful for me because I think my understanding was that it was more geared towards Michigan residents. And so I gave it a shot and luckily I was accepted. I had a family when I went to medical school. I had one child before and then I had another child during medical school. So when it came time to doing kind of the match process and considering where we were going after already having just moved from California and doing a big trip all the way up to Michigan, it was kind of a little anxiety provoking about leaving everything up to the match and, where we would be mandated to go essentially based on that. And so really I started to ask around my mentors, like what are other options and advice. And they had mentioned the TIP program, which I had somewhat heard about, but not really too extensively familiar with what it entailed. And after asking around and meeting with some other TIP graduates who were there in Lansing also, it just sounded like a really good opportunity for my situation, having a family and wanting some stability for my kids. We had already been in Michigan for 5 years, and so they were set up in school and we all had friends and it was a good life for us. The process was pretty easy. It was a little less anxiety provoking than I presume, doing the rest of the match interviews and all of that was. I knew I wanted to stay in Lansing and not go to the other campuses, although I did appreciate that those were also options for me. It's nice having the community-based like residency, availability that MSU has. It's very unique, I think, to other medical schools. And so if you wanted to practice rural medicine, go into the UP, like there's just a lot of different options with practice locations. So I went and interviewed and it was a very kind of laid back, relaxed. I think they kind of, they have a different appreciation for someone they know is already interested in their program and choosing their program versus going through the match and kind of maybe not being their first choice. They knew that this was my first choice because I was applying early. So that was nice. Once I got to residency, I found that it was a great benefit having done that year already where I was going to their didactics and kind of had some relationships with attendings already and residents that were ahead of me. Sorry, husband's calling. So yeah, once I got there, like already knowing the system, already having used the EMR a little bit, knowing the hospital system, like just having my feet wet and being very familiar with everything was comforting. Starting that first day of residency, you're so nervous. And so having that under my belt already gave me some level of comfort. And then I found also that other residents who did not have that opportunity kind of looked up to you and I became a mentor to them as far as teaching them the ins and outs of the different departments and where things were and how to use the EMR. And I think that I did a chief year at the end. I was a chief resident at the end. And I think that TIP year that gave me the ability to kind of be a mentor and have, my fellow classmates like look up to me in some respect. I think that helped in my being able to be chief too, because they vote you in. And so I think that there was some level of appreciation or camaraderie that I was able to build with them all the way from the very beginning that helped me out with that. I think being chief obviously has some benefit later too, it looks good on the resume. So whether or not that was part of my being able to get a job where I wanted to later on, I don't know, but potentially. But it was just all around fun. I think it made I can't speak because I didn't go anywhere else, but I assume that it made my experience much more pleasant than, going to a location where an algorithm kind of determines where you go and you're new and don't know the area and you have a very short time frame. By the time you're done with residency, you're just getting settled in and now you're potentially moving again. I would have stayed in Michigan. I mean, that's kind of the point of TIP, is that they want to match people who have an interest in staying there. And that was ultimately my goal. I did want to actually work for the residency that I had gone to, and had talked with my program director a little bit about that, but for various reasons, mostly with my family, it didn't work out. And so we ended up moving, but I would go back in a heartbeat if the family piece ever worked out.